Have you noticed that some of your favorite Hollywood stars look different lately? Thinner, with sharper cheekbones, hollowed cheeks, and a gaunter appearance, and wondered what's behind the change? Could it really be a new drug sweeping through Hollywood? Or is there something else at play affecting the faces of the rich and famous in 2026? Fans, media outlets, and health professionals have all taken notice of a new trend in 2026. Many Hollywood celebrities look very different from how they did 2026 a few years earlier. Some of the most iconic faces in entertainment today have gaunt features, such as hollowed cheeks, prominent cheekbones, drooping skin, and deeper wrinkles around the mouth and eyes, in addition to just having smaller bodies. This tendency has been called Ozempic Face by tabloids and social media users. However, what is the Ozempic Face? Is it a visual acronym for something else entirely? Or is it a real adverse effect of the medication Ozempic? A deeper examination of the substance, its effects, the biology of rapid weight loss, and the larger cultural and aesthetic forces that make Hollywood especially vulnerable to such shifts are all necessary to comprehend the phenomena. Semaglutide, a drug originally created to treat type 2 diabetes, is sold under the brand name Ozempic. The medication functions by imitating the naturally occurring hormone GLP-1, which controls blood sugar and hunger. Semaglutide helps patients cut calories, which can lead to substantial weight loss by decreasing stomach emptying and boosting sensations of fullness. Ozempic and its related medications, such as Wegovy and Mounjaro, have gained appeal as weight loss remedies for those without diabetes, including many celebrities looking for quick results, despite being first given for the control of diabetes. The phrase Ozempic Face first appeared on social media to refer to the obvious changes in facial appearance that can accompany major weight loss, as public celebrities started openly publicizing their usage of semaglutide medicines. The phrase swiftly gained popularity because to eye-catching before and after pictures of famous people and popular conversations on Twitter, Instagram, and TikTok. Medical professionals stress that Ozempic Face is not a side effect of the medication that has been shown by science. Rather, it represents the normal repercussions of rapidly losing facial fat in tissue, frequently in conjunction with changes in skin flexibility brought on by aging. According to experts, fast facial fat loss is the main cause of Ozempic Face. Layers of subcutaneous fat give the face its youthful smoothness and shape. A more hollowed-out, angular appearance may result from these fat pads shrinking. The following are some of the characteristics most frequently seen in Ozempic faces. Hollowed-out temples and cheeks that highlight the underlying bone structure. Loss of volume in the orbital region causes sunken eyes and more noticeable under-eye circles. Sagging skin around the neck and jawline as a result of the skin's inability to retract after losing its underlying support. Less facial padding and deeper creases around the mouth and eyes. A typically older or thinner appearance, even if one's basic health is acceptable. These alterations are not unique to Ozempic users. They can happen with any substantial or quick weight loss, including diets, vigorous exercise, and surgical procedures. Ozempic is unique in that many users lose weight quickly, which might worsen these changes to the face. Facial fat supports the features that identify youth, maintains facial volume, and cushions the skin. Sagging, hollowing, and more noticeable wrinkles can occur when fat is eliminated too quickly because the skin and soft tissue may not have enough flexibility to adapt to the new shapes. It is more difficult for older persons to keep a plump, young appearance after rapid weight loss, since collagen and elastin, two proteins essential to skin firmness, gradually deteriorate with age. Additionally, if protein consumption and exercise aren't strictly controlled, considerable muscle loss may accompany fat loss. The Ozempic Face's optical alterations are exacerbated by the combined effects of muscle and fat loss. These modest biological impacts become very visible and widely discussed for Hollywood stars, who are frequently the subject of intense public scrutiny. This creates a cultural phenomena around a medical procedure that is actually fairly ordinary. Ozempic faces are particularly noticeable among celebrities for a number of reasons. First, physical attractiveness is highly valued in the entertainment industry. Even slight changes to the face are immediately apparent due to photos, red carpet events, and social media exposure. A celebrity who rapidly drops 20 or 30 pounds may draw notice for changes in facial shapes as well as bodily metamorphosis. Second, a lot of celebrities have access to drugs like Ozempic, which can speed up weight loss more efficiently than just diet and exercise. The possibility that the public will notice and discuss the outcomes is increased by this combination of visibility and quick transformation. Third, media outlets and social platforms are quick to label and sensationalize these visual changes, often coining catchy terms like Ozempic Face that stick in popular culture. There are differing opinions regarding the so-called Ozempic Face epidemic. Some followers who see weight loss as a kind of empowerment or metamorphosis commend celebrities for reaching their aesthetic and health objectives. Some criticize the narrative for encouraging false expectations on aging and body image, or for maintaining unhealthy beauty standards. Social media criticism, in particular, frequently presents the phenomena as a warning. Younger audiences may seek rapid weight loss without realizing the physiological or aesthetic repercussions, such as possible sagging skin, facial volume loss, and even metabolic stress, according to observers. The conversation has spurred more extensive discussions about the demands of celebrity culture, the morality of weight loss medications, and society's fixation with youth and looks. Experts advise against just blaming Ozempic or related medications. Although semaglutide drugs might hasten weight loss, the changes to the face are essentially the result of quick fat loss rather than a special pharmacological adverse impact. Similar alterations can result following any severe weight loss, including dieting, surgery, and other medical procedures. Dermatologists and aesthetic specialists observe that with careful planning, the Ozempic facial appearance can be controlled and lessened. Professionals frequently advise people who are worried about facial changes to gradual weight loss. Reducing weight gradually lowers the chance of sagging and hollowing out and gives the skin time to adjust. Strength and resistance training. Maintaining facial fullness can be achieved by maintaining muscular mass beneath the skin. Sufficient nutrition. The synthesis of collagen and elastin is supported by a diet high in protein, vitamins, and minerals. Hydration and skincare. Skin elasticity can be enhanced with regular moisturizing, sun protection, and even collagen-stimulating treatments. In an era where celebrity transformations are instantly scrutinized and amplified, the term serves as both a warning and a conversation starter, reminding audiences that appearances can change quickly, that medications like Ozempic are tools rather than magic solutions, and that the pursuit of health should always be balanced with awareness of its aesthetic and emotional implications. If you want the real story behind Hollywood's biggest trends and viral transformations, hit that subscribe button and turn on notifications so you never miss an inside look at the stars and the science behind their new looks.